Hi, Brad Town here for Conquer Dental Seminars. I'd like to introduce you to my newest webinar, Oral Surgery for the General Dentist, Dentoalveolar Surgery. As a general dentist, you typically are not performing extractions, bone preservation procedures as frequently as you do your other general dental services such as fillings, crown and bridge, preparations. Those are the procedures that you generally are doing day in and day out. So when it comes to oral surgery, sometimes you can find yourself wondering, what is the next step I should take to complete this extraction after the crown has fractured or when faced with a dilacerated root and you've started the process of removing it and now find yourself not sure what the next step should be to complete it. Well, my course is designed to help you navigate these pitfalls and challenges in the dentoalveolar surgical arena. The outline includes indications, procedures, instrumentation, techniques, potential complications and management, as well as postoperative care. This is an overview, and the course goes into depth on all of these topics. We start off by just the general understanding of the first steps to take in anticipating the performance of a surgical procedure. We go on to discuss those elements that are implicitly a part of any surgical procedure in terms of completing it successfully. We will talk about the procedures themselves and the steps that are necessary to complete the procedure. We'll talk about what my systematic approach is, which includes planning your surgery, visualizing your plan as you are looking at your diagnostic images, your x-rays, your clinical evaluation, and then how to execute that plan successfully. Instrumentation today is more than just a set of universal instruments. In order to successfully complete oral surgical procedures, particularly dental extractions, you need to have a comprehensive set of instruments. And I'm going to show you how you can narrow that down to a manageable set of instruments that will allow you to complete extractions and maintain bone as safely and efficiently as possible. We will then go on and talk about different actual techniques in terms of removal of teeth. How do we apply the use of specialty forceps to ensure that we remove teeth with as minimal damage to the associated dentoalveolar structures? And when do we make the decision that an actual surgical procedure is better than a simple extraction in terms of being conservative? We'll talk about my decision tree on the steps that you should take and instrumentation that would be necessary depending on the degree of difficulty that the tooth or teeth present. We'll talk about some of my tips and tricks for successfully removing teeth without damage to the adjacent bone. We'll look at that decision tree as it goes all the way up through the hierarchy of and including flap development and what types of flaps there are. We will go on to talk then about bone removal versus tooth sectioning and how do we successfully make the decision to maximize preservation of bone. You know, one of the main complications in dentoalveolar surgery, extractions, can be root tip fractures. How do we retrieve roots with a minimal of osseous destruction in the process? Again, recognizing that bone maintenance preservation is paramount today because our restorative procedures are so focused on optimizing and maintaining the dentoalveolar process. Then we'll go on and talk about the various bone preservation techniques the materials that can be used. We'll talk about bleeding as well as what materials we have to help manage bleeding complications. We'll talk about suture techniques and what their indications are in terms of managing soft tissue and preserving architectural integrity. And then finally, we'll cover postoperative care and what we would ask our patients to do to help optimize the recovery and healing. I look forward to you joining me on February 2nd for this excellent course on dental alveolar surgery. Thank you for your attention.